So, what types of questions do parents have when it comes to the vaccine?
The vaccine meaning
The COVID
COVID
vaccine, yeah.
vaccine. Well, the interesting thing is the questions that I was asked today is a little bit different than some of the questions I was asked last week. I think with this little uptick again in positivity rates, with what's been going on with other states and more people getting ill, some children going back to school around the country, parents are starting to get really concerned. Should I really get this vaccine for my children? Where last week it was, what do you think? And we've been very much in tune with what's going on in the community. And as we see more and more people, um, fall to this terrible, dreaded disease that's now really 18 months. It hit on March 13th. Well, what date is this coming Friday? But August 13th. So we will now be almost 18 months in what's been going on. You have to be sensitive. There are some people that are still a little skeptic about, do we really need this for our children? They're not sick. We're seeing now in Florida, 1 in 5 positive tests are children under the age of 18. So while they may not be sick and they may not be dying, and I'll tell you a story afterwards, we know that people are getting ill and the children are starting to spread it. At a couple of the beach towns down along the New Jersey shore, there have been some of these teen parties where many teenagers are getting sick, and they were kids that could have been protected a while ago. Remember, we only dropped the age from 16 down to 12 about 2 months ago. It's when we started vaccinating in our office. And we've had parents really say this is a wonderful thing. We need to protect these kids. We need them to be back in school and be learning in an environment the way you and I went to school, with our friends, having lunch, playing tag outside at recess, to come back and finish up the day, to only go home and do your homework, as compared to children sitting in front of a screen. So parents want to know the answers. And as pediatricians, we need to be ready to tell them what the real story is.
So, let's go through some of those questions. The biggest one, is the vaccine safe?
Well, I took it. My arms are still here. Um, right now, we know the technology has been out there for several years. Yes, it was a vaccine that was rushed, but the scientists are the scientists. And if you believe in science, you have to believe that what the doctors that did the research, that have proved all that we need to know through trials, is what's going on. I've already mentioned about, to my patients, I have a friend who has enrolled her 4-year-old and her 9-year-old. She's practices down in North Carolina. We want to be able to roll that age down even further. I have 2 grandchildren. I want them to be vaccinated. We see from everything that has been presented to us, and this is what goes on through the CDC and their meetings with the FDA and the ACIP, that tells us what we need to do, that the vaccine clearly is safe, and that most people that are vaccinated the way they need to will be protected against this dreaded virus.
What do you say to parents who say, well, my child has not been sick with COVID yet, and what we're seeing is reinfection of vaccinated people? Why should my child get this vaccine if when you get it, you can still get the virus?
Yeah, we know that some people that have been vaccinated on time, with the set amount of weeks in between, or one vaccine, the way the Johnson and Johnson vaccine has been marketed and put out there, is even the people that do get sick after being vaccinated are not nearly as ill. There are some ill. We don't know how everybody responds to the vaccine, but we know that historically with the flu vaccine, which we know only covers about 70% of people with an uptake, helps people, helps children. We didn't see flu this year. We haven't seen a lot of RSV until the last couple of weeks. And what we know is, as seasons change and people are protected, we know that these people that are vaccinated will be healthier than people that are not. And to say, well, that they still got sick, or maybe they ended up in the hospital. Again, I'd rather wear my seatbelt when I'm driving my car through parts of Brooklyn, Queens, or even northern New Jersey, where I am right now.
And how about the concern that the vaccines are still for emergency use authorization and they have not been fully authorized yet? Although
Yeah,
we
I mean,
know it's applications have been filed.
yeah, we know with the EUA, it was emergency use authorized. We know that with some of the testing that's being done, those are also EUA. But our thought is that over the next several weeks, hopefully that EUA will be taken away, and hopefully with all the papers that have been filed with the FDA, that it will not be an EUA anymore. And then maybe, hopefully, more parents will buy in for their children, and more adults, whether they're your friends or my friends, will then say, hey, I need to get my vaccine now. It's not just out there to protect us. It's out there to protect us, our families, our community, our next door neighbor. We need to have everybody protected. Otherwise, this could be a dreadful fall.
And I think that probably maybe the biggest concern parents have is the unknown about the long-term impact, because we haven't been in the pandemic long enough to know, we haven't had the vaccines long enough to know 5 years, 10 years, 20 years down the line what taking this vaccine could mean. How do you allay those concerns?
Well, I think the biggest concern that we see with that is, tell me about the future, Dr. Bienstock. And I really can't tell them for sure. I don't have a crystal ball. I can't tell you what I'm going to have for dinner tomorrow. I hope it's going to be a wholesome meal. I have a wonderful family. I have a wife that's a great cook. I know that there'll be something good on my plate tomorrow night for dinner. As far as the vaccine and what's going to happen 5, 10, 20 years, many parents with teenage girls are worried about fertility and will this change or impact their menstrual cycle? We don't have those answers. And if anybody does, I hate to say it, I think some of it is speculation. But what we have seen is, so far things look good. And by meaning good, we've been vaccinating now since the middle of December. Do the math. Somebody could have been pregnant in the middle of December, got vaccinated, and now is delivering a baby that's maybe a little premature. I had a mother and father in today with a 5-day-old. They both had COVID 3 months ago. Fortunately, their baby was healthy. I have a friend whose daughter-in-law was pregnant, was unable to get vaccinated where she was in another country, and she ended up losing that baby during the whole pregnancy and is devastated by this. We don't know what's coming, but what we do know is what we see in front of us. And what we see in front of us is, if we're vaccinated, we're protected. If we're protected, we will be around 5, 10, or 20 years from now.
And as a pediatrician, as families are preparing to send their students to school, as school districts are preparing to welcome students, what's your biggest concern of having that mix of vaccinated and unvaccinated people indoors, under the same roof at full capacity?
This is a big concern for pediatricians always as we enter the fall season and kids come back. It's a melting pot. Growing up in New York City, I grew up with multiple ethnic groups, multiple socioeconomic groups. And to say that I did not have friends, I mean, my best friend, Granville White, will tell you that we played together, we acted together, we did everything together. And here we are, we need to get those children back in school. They need to be masked. We're seeing vaccinations being mandatory at many universities in our area and around the country. I have parents saying, well, they're going back in 2 weeks. How am I going to get 2 shots in? Well, guess what? Get the first shot here. We'll help you arrange for the second shot when they get back to University XYZ. But for these children to not be in school, I don't think from a mental health standpoint, this is going to be any good if we cannot get children back in school in front of their teacher, in front of their peers, saying hi to the janitor, having the principal welcome them every morning, come back to school. We need to get them in school. We need to have as many children vaccinated as we can. We need to make sure that these kids wear their masks. There's a lot of mask fatigue going on now. And, I'm pretty happy with Mayor de Blasio saying, got to get those masks on. If you're coming in my restaurant or any restaurant, show us your vaccine card, put on your mask. We need that. We cannot live through another fall. I think people are short-sighted and don't remember how bad things were a year ago. You know, thousands and thousands of deaths each day. I have friends that work in the hospital, nurses that were ICU nurses, and the stories they tell, very frightening, what they had to endure and watch as families were splintered and could not be with their loved ones when they needed them most.
But in terms of having school buildings with both vaccinated and unvaccinated, both adults and children, do you think that poses a health risk?
Yes, I think it does. And I think the potential there for the spread of illness is significant. If it was up to me, I would make vaccines mandatory for anybody over the age of 12 right now. We know children typically do get vaccinated for childhood illnesses before they enter kindergarten, whether it's measles, mumps, rubella, tetanus, hepatitis B. And I'll be honest, while those are serious illnesses, we do not see the deaths today because of vaccines. And the implementation of vaccines being in place has saved hundreds and hundreds of children each year in school. We need to get them vaccinated. We need to have these adults get vaccinated. Initially, Rutgers University was one of the first universities to make mandatory vaccination for its returning students in the fall. Well, guess what? They didn't require that of the janitors, the administrators, or the professors. As we've learned more, we need to make sure that anybody that has an arm or a leg can get vaccinated and get vaccinated promptly so that we can have smooth sailing as we enter into the fall. And hopefully, and I pray that we don't see a resurgence again with positivity rates going through the roof.
Well, you've answered my questions. Any more questions that you get from parents that I did not know to ask?
Many of them asked me, Dr. B, what would you do if this was your family? And as I mentioned, I was vaccinated back in December. I had my second shot in January. My wife, my children, my daughter-in-laws are all vaccinated, and we were vaccinated early on. And people look to us, we're the knowledgeable ones. We're the ones that wear a stethoscope. We're the ones that went to medical school. I'm not spending time blogging on any of these social media sites with one story. We are blogging about people that have a history here. I have a friend that I went to high school with. He was a radio broadcaster down in Southern Florida, was a non-believer in vaccination. Well, you could probably figure out the rest of the story. He contracted COVID, was laying in his hospital bed, now tweeting out and calling friends saying, you need to be vaccinated. This is no joke. 2 days after his 65th birthday last week, he passed away. A horrible story that could have been prevented. We can't have that happen again. We can't have our loved ones perishing in front of us from a disease that can be controlled with safety of vaccines and safety of wearing a mask.